Okay, hello, this is Enid with an elbow anatomy review for PTA 200. The elbow is made up of 3 bones, the distal humerus, the proximal radius, and the proximal ulna. Landmarks of the humerus include the trochlea, the capitulum, posterior view and anterior view, as you can see. Your medial epicondyle here and here, lateral epicondyle here and here, your supracondylar ridge, and the olecranon fossa on the posterior aspect. So when you look at these landmarks, I want you to think about what they articulate with. So what does the trochlea articulate with? What does the capitulum articulate with? And then also on these bony landmarks is what muscles or tendons attach to these bony landmarks. So what might be attached at the supracondylar ridge or at the epicondyles. So think about those things when you think about these bony landmarks. Okay, bony landmarks of the ulna. Well, now this kind of gives you the answers here, huh? The olecranon process, where the triceps attach, the trochlear notch, which obviously articulates with the trochlea, the coronoid process, and the ulnar tuberosity. Oh, they're put together because that's where the brachialis inserts. But also, what does the radial notch articulate with? What does the coronoid process articulate with? Then your radial notch articulates with the radial head. I still gave you the answer, sorry. And then the styloid process, which is in the distal ulna there. Landmarks of the radius, you have the cylindrical radial head, the radial tuberosity, which would articulate with what on the ulna. That's also where the biceps inserts. And then on the distal end here, you have your styloid process of the radius, where the brachioradialis inserts. So the elbow, I talked about being 3 different bones, the humerus, the radius, and the ulna, so there's also 3 articulations. The articulation between the humerus and the ulna, or the humero-ulnar joint, where that trochlea articulates with the trochlear notch and that coronoid process of the ulna. The humerus and the radius, the humero-radial joint, is the capitulum, articulates with the head of the radius. I remember this by putting the cap on the head. So if you have any difficulty. And then there's the radio-ulnar joint between the radius and the ulna. And that radial head will pivot in the radial notch of the ulna. Prime movers of elbow flexion is your biceps brachii, which has 2 origins, the long head in the supraglenoid tubercle and in the labrum, and in the short head on the coracoid process, comes down the anterior forearm, inserts on that radial tuberosity, and I believe it's also in the aponeurosis there. So the primary function for the biceps brachii is elbow flexion. It also performs forearm supination and shoulder flexion. The biceps is innervated by the musculocutaneous nerve at C5-6. Then the brachialis, which is deep to the biceps and more distal, but this is considered really the workhorse of the elbow. So its origin is on that distal half of the anterior humerus. The insertion is on the coronoid process of the ulna and that ulnar tuberosity. Of course, the motion is elbow flexion, also innervated by the musculocutaneous nerve C5 through 7. Brachioradialis comes from the lateral supracondylar ridge of the humerus, inserts into the radial styloid of the radius. It works in elbow flexion. obviously I said that, and innervated by the radial nerve at C5-6. So this says most effective as an elbow flexor in neutral pronation, supination. So neutral pronation and supination is considered like the thumb is superior, so that the hand is more in that sagittal plane, and that's where this is most effective as an elbow flexor. Elbow extension, performed by the triceps brachii, the long head, originates on the scapula, the lateral head, proximal half of the posterior humerus. The medial head, which is created by this dotted line, is deep to those other two heads on the distal half of the posterior surface of the humerus. They insert onto the olecranon process and are innervated by the radial nerve, C6, 7, and 8. The anconeus, or anconeus, depending on, again, regional differences, originates on the lateral epicondyle of the humerus, inserts lateral and inferior to the olecranon process of the ulna. It assists in elbow extension, so not necessarily a prime mover, but definitely assists. And it's innervated by the radial nerve, C6, 7, 8. Forearm supination, performed by the, surprise, surprise, supinator. It originates on the lateral epicondyle of the humerus and adjacent posterior ulna. So this is more of an anterior view, and this is more of a posterior view. It inserts on the anterior surface of the proximal radius, right here. It performs supination and is innervated by the radial nerve, C6, 7. Pronation, got the pronator teres. So it starts, or originates on the medial epicondyle of the humerus and the cornoid process of the ulna, and then inserts the lateral aspect of the radius, kind of at the midpoint here. It also, besides pronation, will assist in some elbow flexion and is innervated by the median nerve at C6, 7. The pronator quadratus. So this is a distal pronator. The pronator teres is proximal. This picture just gives you a little better orientation of where these are both oriented or located. So it originates on the distal fourth of the ulna and inserts on the distal fourth of the radius, innervated by the median nerve, C, 7, and 8. These are just anatomical relationships that I wanted you to look at, and some that we've already talked about. Here you'll see that the brachialis lies deep to the biceps. It can be palpated at the distal humerus, here, on either side of that biceps tendon. The brachioradialis is the most superficial muscle on the lateral forearm. The pronator teres is somewhat superficial, however, the pronator quadratus is deep. On the posterior surface here, I think I already mentioned that the medial head is deep to the lateral head and the long head. The anconeus is a little more superficial here, and it's just distal to that triceps insertion. And then the supinator, it's not on these pictures. Oh, no, okay, we'll go back to the first one. Supinator is deep to the origins of the wrist extensors and the brachioradialis, and that's just to, give you some idea of how those relate, and those pictures came out of your textbook as well. Anyway, again, this is Enid signing off on Elbow Anatomy. Thanks.